Meanwhile, the Treatment Action Campaign has been discussing the proposed NHI for almost a decade. For the first time, it emerged in public view. The TAC's General Secretary is Anele Yawa. Anele, good evening to you. We understand the problems, or we certainly know the problems in our healthcare system. It's really indefensible that the majority of resources is spent on the minority of people. Is the NHI the right response?
Greetings to you and greetings to the viewers at home. From where we are seated as TAC, we are for a universal health coverage. And if NHI is a vehicle for us to reach to that destination, therefore we support it. But also, as TAC, we are not just supporting the NHI blindly. You will remember that between 2012 and 2017, the country started the NHI pilot project, which we were part of it in terms of monitoring what was happening. And then after that, the country started the process of consultations. And as TAC, together with Section 27, we made our written presentations to the Health Portfolio Committee, and we also went to the Health Portfolio Committee to do oral presentation where we listed a number of issues. And as it stands now, what we know is that as the country, we've got a broken public healthcare system, which is failing the majority of the people. And if NHI is going to address those issues which are experienced by the majority of the public healthcare users, all what we are saying, let it be implemented. But also, when we implement NHI, it is important for our government to listen to the voices of civil society, communities, and other organizations that represents users of the healthcare services, because there is this perception that everybody who is making comment on NHI is anti-NHI. We are not anti-NHI, but we've got comments and concerns that we made on a number of sections which we think that the Parliament is going to consider our concerns and all what have you, so that as the country we can be able to move from the direction of a broken public healthcare system to a direction which seeks to fix the broken public healthcare system. There are a number of issues that our country is still confronted with. One of them is around the shortage of human resource for health. We've got issues around infrastructural challenges in our facilities. We have challenges around corruption and theft within the healthcare sector, where in a number of provinces, like in Free State, 2020 January, there were a lot of cases of people who were arrested stealing ARVs in number of facilities. So what we are saying, NHI, we must not look at it from the point of view of just a piece of paper. We must look at it from the point of view of how are we going to implement it? How are we going to make sure that we bring confidence to the people of our country, as well as that hope of saying, if the NHI is implemented, we are not going to hear stories of monies that are being stolen from the public purse. We are not going to hear stories of medicines being stolen in our facilities. We are not going to hear stories about people who are being chased out of these facilities because the problem that we have now, majority of people are denied services if you don't produce a referral letter when you go to the facility, or if you do not have an ID. So the question we need to answer as the country, how do we make sure that we close those gaps? Currently, as the country, we've got a problem within our healthcare system of patient files that keeps on missing, and if files of the patients are missing, it therefore means the medical record of that patient is also missing. And we were promised during the NHI pilot project of, among other things, we were promised of a unique patient identifier, which will allow me to access healthcare services anywhere in the country instead of being asked referral letters and IDs. So if the NHI is a vehicle that will see the people of South Africa, those who live and work in South Africa, will be able to access healthcare services adequately without being discriminated, without being denied services. Therefore, we support it. But also, our government must understand our point of view as civil society to say we are not anti-NHI, but it does not mean that when we have concerns, we cannot speak out. Thank you.
There are many people, many commentators, people who oppose the NHI, so people who disagree with you. They say that they don't believe government has the capacity to implement this system. Is that where your concerns lie? The issue becomes around how it will actually be implemented. Do you believe it is possible by government at the moment?
So as it stands, these are two processes. One, it is about the bill being enacted to an act. Then after that, we are expecting the government to also consult us in terms of the implementation plan. Because at the present moment, we are not talking about the implementation plan of the NHI. And I'm sure when we are presented with the implementation plan, we will be able to be afforded an opportunity to make some inputs on how should the implementation plan look like in order for us to ensure that what is enshrined in Section 27 of our country's constitution is realized by all those who are citizens of our country, those who work and live in South Africa.
Anele Yawa, thank you very much indeed, General Secretary of the Treatment Action Campaign.